jobs, whether it be organizing, whether it be politics. This is a well-rounded individual. You name the subject, and he can talk on it. Today, it's healthcare, but we're not restricting him to anything. He can talk about anything that he wants to talk about this morning. Brothers and sisters, guy who really needs no introduction, a solid friend of the trade union movement, a solid friend of state and central labor council, and I can speak from experience. He doesn't realize it, he is a constituent of mine because he happens to reside in Washington, D.C. And any national president who lives in the metropolitan Washington area, I claim that. You got it? You got it? Okay. Brothers and sisters, Cohen, President of the Communication Network of America.
Thanks, Josh, and I'll be brief. We do have another conference going on, but as a long-time single-payer supporter, wasn't going to pass up the chance to say a quick hello in here. And Josh and I actually live in the same neighborhood, so I got to particularly be careful or he'll run into me in the street, right, Josh? Yeah. Down in Southwest D.C. Anyway, I want to thank all of you for what you do, and I see Clyde Rivers here from the AFL-CIO Executive Council, probably others here, for what you do. I think all of us involved in the healthcare fight know that single payer is the only real solution. Everything else is a step along the way at best. Hopefully we're not stepping backwards. We have been very involved, CWA, and I give a shout out to the CWAers in the room. I see a bunch. We've been very involved not only supporting single payer for years, but trying to figure out, what are the steps towards it. And sometimes, we might even disagree on that, some of us here. Within our union, we often have disagreements, it's fine. But we all know, where we want to get to. This current fight in terms of healthcare reform in the Congress, I don't think any of us thought a year ago that this is where we'd be now, that we'd be aiming this low. But, sort of my job and our job is to not necessarily put a happy face on a pig, but to see if we can make something out of this. It's no different than the bargaining we do in these kind of times. We learn a lesson every day, as Josh always teaches us, that we need to build a broader and bigger movement, that fewer of us and more militants isn't really going to get the change we want. We need more of us and also more militants, more activists to do it. So, within our own union, and I'm sure within this room this weekend, I know that originally you thought you'd be here, what are the next steps? Something would have already been done. And how do we take the next steps, whether it's on the state level towards single payer or federally, more likely, in the case of single payer, probably on the state level for now. But instead, here we are, trying to make the best of this and seeing if we can get some step towards universal care, more affordable care out of this current debate with the White House, the Senate, and the Congress. I guess I'm still, if you pin me down, thinking we can, number one, eliminate most of the excise tax. The whole idea is a bad idea. But we have been involved, CWA in particular, and other unions here. We had hoped that we were raising a lot of money for healthcare reform to go forward, and we ended up having to spend a lot of our members' time, money, the resources of our activists to fight the excise tax, and I appreciate everybody here helping on that. Again, if you had told me a year ago that that's the fight we would have had to take on, I would have said, oh, come on. But we did. We've gotten rid of at least 80% of it. It's put off till 2018. Ideally, well, not ideally. We have to do something better than whatever we're going to get done now. Before 2018, the whole thing's going to collapse in any case. But anyway, I think there are still some positive aspects, particularly from the House bill, that have a chance to survive here. Some notion of universality, some curbing of the insurance company greed, and the kind of rates they charge. So we still are trying to stay with this, keep the coalition together, and make some kind of initial step. But what I really wanted to leave with here is, our union was committed before, 5 years ago, at a convention through resolution action to single payer. We remain committed to it. We remain committed, whether it's on a state basis or federally, for working with all of you and to doing what we can to bring our country into the 21st century. We know what the global standard is in terms of health care. We're nowhere near it. We know what the global standard is in terms of workers' rights. We're nowhere near it. We know where the global standard is in terms of progressives building a political movement, and we're nowhere near it. So I think if we can combine these ideas, we can continue to build a base, and we continue to work together not only for decent health care in this country, but for economic justice. Thank you.